Ping An is fortunate. We own the largest. We are the sponsor for and a large shareholding, and created the largest telehealth platform in the world. It's actually a independently listed company on the Hong Kong Stock Exchange these days, but still tightly interwoven within the Ping An group. To answer your sort of background question, before the pandemic was a thing, Good Doctor was created now about 8 years ago. And I think stepping back to kind of the frame that I was trying to articulate earlier, China is historically a state health insurance system dominated payer market. So the SHI payer platform accounts for about 50% of health spending in the country. Private insurance, even now, is only about 7%, and the rest is out of pocket. So when Peter Ma was thinking about this 7-8 years ago, he was thinking, well, how do we reach beyond that? At that time, only 5 or 4% of the entire payer system was private health insurance. So it was a very small and emerging category at that time. And frankly, it still is relative to the market opportunity. And he was looking for a way to reach beyond that and sort of redefine his addressable market in a new way. And telemedicine was one of the platforms that or ideas that allowed us to do that. So that created the kind of impetus. Obviously, pandemic has been COVID's been a huge accelerator for that platform. Having said that, around the world there are many different models of telemedicine that have emerged, and one of the central questions for telemedicine is how does it sit within the payer system, and especially the government payer systems in those government-sponsored health markets around the world. And one of the changes that we saw for the first time arise from the pandemic in China was in the province of the city of Wuhan, which was the epicenter of the pandemic, of course, initially in China. We, for the first time, saw telemedicine as a reimbursable expense, and that has, on a limited basis, sort of proliferated somewhat in China. We've seen the advent of this concept of internet hospitals, so hospitals themselves being highly incented to offload their own traffic by partnering with telemedicine providers, or themselves, in some cases, trying to become telemedicine providers. Obviously, there's huge advantage if you're a massively scaled player like Good Doctor, since we now have in excess of 400 million registered users and are in fact the largest player in the world. Our own paying patients have grown in the last 12 months by 70%. And what we're doing with the platform, as I sort of indicated earlier, is making it the kind of centerpiece of that corner of the triangle that is about delivering integrated provider services to insured clients, and then using the idea of that first automated triage, remote care through on-staff doctors that we have that can interact with patients via mobile platform, using that as the starting point. There's obviously quite a lot we can do to serve patients' needs, including prescribing and delivering pharmaceuticals for quite a wide range of pretty simple conditions. But of course, there's going to be need for referral to physical providers, and that's where our clinic network and our partner hospitals come into the mix. One last thing I'll say is that for those that follow the Ping An story or the China insurance sector, people might be aware that we made an acquisition some months ago, or announced an acquisition some months ago, of parts of the Peking University Hospital Group called Founders Group. As part of that, we've acquired, I think, 11 hospitals, including a number of world-class hospitals within the China health system. Part of the strategy there is to enhance our provider capabilities so that not only can we have partner hospitals to whom we can refer patients, but we can actually have our own hospitals and increasingly develop a much more integrated set of services for patients.